Developing right now as the coronavirus spreads, the world is reacting.
Well, today we're learning more about a new coronavirus case in California that's not linked to international travel. Health reporter Stephanie Stahl joins us now. So, Steph, no clue how this patient got infected?
They're still trying to figure it out. Jim and Janelle, there are a lot of unanswered questions about this newly revealed patient, but it is an indication the coronavirus is spreading in the United States. It's what health officials predicted would happen. The first case of coronavirus with no immediate links to worldwide travel or a related illness has been identified in a patient hospitalized in California.
There's probably other cases out there in the community that we don't know about.
Doctors at UC Davis Medical Center are concerned the patient might be the first of many infected by someone else in the general population. The patient was transferred last Wednesday, already intubated and on a ventilator. The individual wasn't tested for coronavirus until Sunday, and the results came back positive Wednesday. It's the first case of what doctors are calling community transmission.
It suggests that we don't know where they got it from, so the person who exposed them probably exposed others.
Wednesday night, President Trump tried to ease fears over the coronavirus outbreak.
The risk to the American people remains very low.
At the White House, Mr. Trump tapped Vice President Mike Pence to head the administration's response.
We're ready to adapt and we're ready to do whatever we have to.
But federal health officials warned more infections are likely.
The trajectory of what we're looking at over the weeks and months ahead is very uncertain.
Now, symptoms of coronavirus are similar to the flu, fever and respiratory issues, but there is growing evidence the virus can be spread by people who have no symptoms, raising concerns there could already be more cases in the United States that have not been detected. Best prevention is to wash your hands, cover your coughs, and stay home when you are sick.
Extremely concerning, Stephanie.
It is.
Advice.
Yeah.
Fortunately, most cases to date have been mild. But it's still developing, so we'll see.
All right, thanks
Thanks,
so
Steph.
much.
Appreciate it. Well, we'll continue to follow the developments on the spread of the coronavirus. When we're not on television, you can get the latest information on our website, cbsphilly.com.